Now, 2 suspected cases of the 2019 novel coronavirus have been recorded at the Korle-Bu Teaching Hospital. The patients, a Chinese and an Argentine, who have been living together in the country for some days now, have been isolated at the facility while blood samples have been taken and sent to the Nguchi Memorial Institute for Medical Research for further analysis. Greater Accra Divisional Secretary of the Ghana Medical Association, Dr. Winfred Ba, spoke on News Express.
I don't think the preparedness in the hospitals is adequate now. So we are told that we had these 2 nationals. One is a Chinese, one is an Argentinian. And they just walked into the emergency room in Korle-Bu. Apparently, and this is what I was told, about 30 minutes ago before I walked in here. So they walked in, they didn't even come for a referral letter, they walked in. Apparently, they said they went to another facility. I won't mention the name. And when the people suspect, one is a Chinese, one is an Argentine. So when they saw them with these Malays and all the same things, they were like, go to Korle-Bu. They didn't even attend to them. They said, go to Korle-Bu. But we were told that the centers are Ridge and Tema General Hospital. But they asked them, go to Korle-Bu. So there's a problem with even communication. So they also came to Korle-Bu, they walked and they got into the emergency room. And then everybody is panicking. And according to the public health director, one of them, so the Chinese left China in September of last year. So we say that it wasn't within the period. But the other person who had been living with him actually got into he also was in Shanghai, but that was in January, and came down. And they've been living together. Now they all develop some symptoms that fits the case definition, but it doesn't mean they have though. They have some Malays. They say only one had catarrh, one of them had a catarrh, but with all the muscle pains and everything. So they've taken samples and sent to Nguchi. But we are taking another sample in the morning tomorrow. So I'm just using this as a scenario. See, are we prepared? The first thing is the communication line. So the first health facility they went to, if they thought that, okay, let's say they thought we are not prepared or we are not a center, what should they have done? They just said, go to Korle-Bu. So there's a problem with communication in the first place. And then when they got to Korle-Bu, now everybody is, I'll see people sending me a lot of text messages. Hey, we hear there's a suspected case. There's panic.
Well, the Director of Public Health at the Korle-Bu Teaching Hospital, Dr. Philip Amo, has been speaking about the status of the patients as of this morning. He's, however, disappointed the Korle-Bu Teaching Hospital has not been factored into the national plan to deal with the outbreak. He spoke on the Super Morning Show on Joy FM with Daniel Datsi.
On Monday, which is 3rd February, both of them started having this constitutional, we call them constitutional symptoms: headache, general malaise, not feeling well, bodily pain, neck pain, low back pain, fatigue. Some of them had chest tightness. One of them had a, nasal discharge and, mild cold, So that is the travel history that made us, because we wouldn't have naturally, the symptoms there does not suggest anything serious. Because of the
travel history that made you suspect. So what's their current condition?
Right. So yesterday, we've been monitoring their temperature so far. When they came in, the temperature was normal, but we didn't track that. So we had to follow judiciously, taking regular temperatures. And so far, up to this morning, the temperature had been normal. The condition of the 2 of them hadn't changed much. The symptoms have not worsened. So that gives us some relief. What we did was to hold them at the holding bay until we sort out a few things, and then we sent them to an isolation room, more or less.
Okay.
Yeah, but the situation, the problem is, by walking into the holding bay of a national strategic center like Korle-Bu, where we have very complicated patients moving from all over the country, in the night, if you come to Korle-Bu, it's no joke. That whole area was on lockdown yesterday. Up to this morning, the whole place has been locked down. No new patient. Yesterday night there was, hard work to rearrange the system, the flow, and everything was done as it should be, so that we will minimize contamination.
Now, the head of disease surveillance at the Ghana Health Service, Dr. Franklin Esiedu-Bequing, speaking also on the Super Morning Show, said by close of day they will be able to map out people who may have come into contact with the 2 suspected persons.
The situation is like we had one last week from the airport. A young guy, he presented 38 degrees Celsius. And we want to see how our system works. So these are not classical definition for coronavirus as we have set it up. So samples were taken and they have been sent to Noguchi. And
how soon will we know if this is coronavirus?
I think by late morning we will have an idea. But what Korle-Bu have done is that they are anticipating that it could be. So they are not allowing people to, they are not receiving new cases. And they will be put into their holding room. So that is the situation for now.
Our editor, Fred Smith, has been there this morning, and he observed that only one doctor entered with PPEs.
Only what?
Only one doctor entered the A&E with a nose mask or with some sort of personal protective equipment.
It depends on where you are, because
he was at the A&E. Yeah. He was at the A&E. He was at the A&E where this happened last night.
Yes, the A&E is a big place, so they have a holding room which is further inside. Yes, and so it's people who are close to them who are supposed to have special protection, because the others are at a different end. So the A&E is a very big place, and it's when you are close to the patients that needs a special kind of protection.
So, Doc, I was doing some digging around this, and I found that these persons actually went to another public health facility, and from there they moved to Korle-Bu.
Yes, what I'm saying is that we don't have such. We are talking to them, but what I said earlier is that they were thinking that they have meningitis. They never even spoke of this coronavirus. Let me be clear. They even have no temperature. Their temperature had stayed even below 37 degrees. It was at 36.8. So what we are seeing is that there's a health system which is highly sensitive to pick cases. And that's what we are trying to do.
Okay. Yeah, that concern was raised because the medical professionals you've been speaking with have expressed concern that they went to another facility and they were simply asked to move to Korle-Bu. They weren't looked at, they weren't referred, they weren't even given a referral letter of any sort. They were simply asked to go to Korle-Bu.
Yes, so I think that we are having a series of trainings that let me even put this thing here. We put up some message that our treatment centers are Rich and Tema. In that light, some people were just moving straight to Rich and Tema that they want to screen for coronavirus. So I want to say that Rich and Tema are not screening centers; they are treatment centers. So let's say, assuming you go to a facility and a doctor suspects that you have coronavirus, they will take samples and let's say it's confirmed, then you move to the treatment center. That's the algorithm that we are using. So what's happening in that facility is not what we expect. What we expect is that if you see a case that could be coronavirus, you put in the holding room, and then if you have the capacity to take samples, you call, and then the people who are trained will take the samples based on the findings. Then you decide where the treatment center should be. So if you need to move the person, the ambulance will move the person to Tema or Ridge. So that's the arrangement that we have made.
Are we going to do any contact tracing to check who these people may have come into contact with, especially in the hospital at Korle-Bu where they went?
Yes. So we are asking, we do what we call the contact listing. So we're getting the list of all persons that have been close. And we do further than that. We're talking more to them to know who their friends are, who their colleagues are. I mean, that's the way we do contact listing. And then you try to trace them for 14 days. hopefully by noon, we will get the results.
And that's when the contact tracing will begin?
No. We try to identify the contacts, that's the contact identification, and you list them, and then you start to do the follow-up. So it's a whole process.
Has it started?
Yes, we have asked them to start identifying the persons that we've come into contact with. So hopefully, by the end of the day, we'll get an idea who the contacts are, and then we'll now do the follow-up.
Now, my colleague and head of the health desk here at JoyNews, Fred Smith, is at the Korle-Bu Teaching Hospital and joins me with a follow-up on this 2 suspected cases at the Korle-Bu Teaching Hospital. Fred, what is the latest?
Well, the latest is that the officials from the Ghana Health Service have arrived here to also take a look at things for themselves. Earlier, we had information that one of the 2 being held in the holding room here had left the hospital or literally ran away from the facility. And that I have been speaking to Dr. Seydou Bekoen, who explains that this man went out. He says he was going to buy food. That's the explanation I've got so far, that he decided to go and buy food, and but he's returned. However, on my arrival here, I saw some men from the police counter-terrorism division who were stationed in front at the entrance of the accident and emergency. That's where we're made to believe the 2 men are being held, Mawavi.
But Fred, how do we allow one of them to go and buy food when they are suspected of carrying a certain virus that we haven't even tested? We don't know what the results are yet.
Well, that's a question begging for answers right now. So in the next few minutes, we're expecting a news conference by Korle-Bu to explain to us if indeed this happened and how it happened, why it happened, and what they intend to do about this going forward.
So clarify, are they keeping 2 persons or they're keeping one is on the run?
As I speak to you, I'm told that 2 are currently in the holding room, the Chinese national, who we now have more details on. We understand he's a banker. And then his friend, who is Argentine, he's the one we are told went to China not long ago. The Chinese, we are told, is very fine this morning, but the Argentine is complaining a bit about throat pain.
So, you know, Fred, are the people in the facility this morning, are they aware of these 2 suspected cases? Do they know what is happening?
Well, this is an isolated room, and so you won't have many people going there except people who have been designated to do this. And so I would believe that those who are going there are aware of the risks involved and what is at stake here, and are duly protected as they go in there.
And Fred, I'm not sure exactly where you are at the Korle-Bu Teaching Hospital, but if you've seen the emergency center where we're told has been locked down, because that's where the 2 men, essentially that's how they walked into the facility, and because we don't know yet if they're carrying the virus, that place has been locked down. I just want you to confirm if you've seen the emergency center, if you've passed by the emergency center, is it accessible to other patients?
Yes, Mamavi, I also heard that rumor or those claims, but I've been to the accident and emergency center myself, and I have not seen any suspension of work or any restriction on people who are coming in. In fact, lots of people have been bringing patients in there throughout this morning that I've been here. No restrictions whatsoever.
All right, Fred Smith, we'll leave it here. Fred is at the Korle-Bu Teaching Hospital. He's head of our health desk, and he is monitoring the situation at the Korle-Bu Teaching Hospital. As you may have heard now, we have 2 people suspected to be carrying the virus. Well, there are investigations underway, analysis at the Noguchi Institute, and we will bring you the latest results. The Ghana Health Service has told us that by midday today, we will know whether or not these 2 gentlemen are indeed carrying the virus or not. But still staying on this matter, the World Health Organization says $675 million is needed to prevent the spread of the novel coronavirus and to protect states with weaker health systems. The strategic preparedness and response plan is aimed at guiding the development of outbreak response plans for different countries. The WHO Director General has stated, and he said the plan would require funding of about $675 million over the next 3 months. The WHO plans to spend some $61.5 million of that on the agency's response to the outbreak, with the rest going to countries at high risk or in need of help.